Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today we are reporting an increase of 16 new cases of COVID-19 in Windsor and Essex County. Of the 16 cases, 10 are close contacts of confirmed cases, 5 are community acquired, and 1 is still being investigated. We have had 13,683 cases since the beginning of the pandemic. 13,056 cases are now resolved and 226 people are active at this time. There are 55 confirmed or preliminary variants identified in Windsor and Essex, and 2 have been identified as the UK variant. 17 cases are currently in the hospital and 6 people are in ICU. We have lost 401 people to COVID-19. There are currently 11 active outbreaks in Windsor and Essex County, 5 workplace outbreaks, 5 community outbreaks, and 1 school outbreak. The Health Unit issued a statement yesterday regarding the ongoing outbreak at the Downtown Mission. Since the declaration of the outbreak in early February, our team has been working with the Downtown Mission leadership, the city and community, and healthcare partners to stop the spread of COVID-19 and to ensure that those at highest risk in our community are protected. After weeks of hard work, we were happy to announce the rescinding of our 29.2 order enabling the reopening of the Downtown Mission and ensuring the return of their guests who rely on their services. We will continue to work closely with the mission and hope that we will soon see an end to this outbreak. The hard work and strong preventative measures in place should help us get there. Now for our vaccine update. A total of 77,670 doses have been administered to Windsor and Essex County residents. Last Friday, we announced that we would be moving to residents 75 years of age and older to receive the vaccine. Today, we are happy to announce that residents 70 years of age and older are now eligible to receive a vaccine through one of our targeted vaccination clinics. To book, simply go to our website at wechu.org or wevax, wevax.ca to book your appointment. You will be able to choose your preferred location and appointment time based on availability. If you do not have a computer or need assistance with booking, please call 226-773-2200. With support from the City of Windsor and Windsor Regional Hospital, booking agents will answer your call and assist you. Residents 60 years of age and older are still able to book at selected local pharmacies based on supply. To find a pharmacy, please visit our website, wechu.org or wevax.ca. If you or a loved one is in the 80+ category and has not yet received their appointment, we ask that you call our booking center at the number 226-773-2200 or go online and book your appointment. We have been able to reach and immunize more than 90% of those individuals that are 80 years and older. However, if there are still people out there that would like a vaccine and have not booked or pre-registered and not hear back, please call our booking agent or go online and book. Please note that any of the vaccinations we're providing are first doses only. If you are given a date to receive a second dose at a mass clinic, the appointment is canceled. Our team will be contacting all residents that were booked for second doses to inform them that at this time, all second doses are canceled. They will be rebooked in about 4 months from your first appointment. If you have not received a cancellation yet, please note that they are suspended for the 4 months. For general inquiries regarding vaccination, please call 211. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us today. On March 24th, Health Canada updated the product monograph for the AstraZeneca COVID-19 vaccine to provide information on very rare report of blood clots associated with the low levels of blood platelets following immunization with AstraZeneca vaccine. Health Canada has reviewed the evidence and has updated the product monograph accordingly. So far, there is no report of this rare event in Canada, but Health Canada is monitoring the situation closely and continues to reiterate the benefits of COVID-19 vaccines outweighs the risk. According to various sources, the incidence on this rare event ranges from 1 in 250,000 to all the way from 1 in 1 million. This is still evolving as new evidence comes in, but so far, Health Canada continue to reiterate that the benefit of getting the vaccine outweighs the risk, and will continue to recommend people to get the whatever vaccine is available for them to receive. I will now move on to our epidemiological summary. Okay, looking at the epi curve in Ontario, as we talked about, we are seeing a slight trend in the increasing cases in the province, with variants of concerns emerging in various parts of the province and in various regions. The trend is going upwards, which is a concern as for the province in general. Looking at what's happening in Windsor-Essex, what we are seeing is a better trend opposite to what's happening in the province, and we are seeing cases declining in our region, and we hope that we can keep it that way so we can keep our community in a better position. Comparing our 7-day average Windsor-Essex versus the province, and similar picture as we have seen, the province is definitely seeing a huge increase in terms of case increase day by day. Compared to Windsor-Essex, where Windsor-Essex we are seeing a relatively stable number of cases, but slightly showing a trend that's moving in the downward direction. But again, it's too early to say that if the trend will continue on in the same direction, but it's just the early indication that at least we are not getting worse. We are either stable or moving in a better position. The cumulative cases and deaths of COVID-19 in Windsor-Essex, a similar picture that we have seen a steep increase in the number of cases, but now we are seeing more of the flattening of the curve as we continue to get to the more recent weeks. The cumulative deaths in Windsor-Essex also is showing some signs of flattening, and we have seen many deaths in the last couple of months, and we are starting to see some improvement as we continue to move forward. Looking at the Windsor-Essex rate by reported week, and this particular slide captures the week-over-week incidence per 100,000 population, starting from week 18th, April 27th, to our current completed week, which is week 11th. Based on our most recent completed week case rate, we are sitting at 44.7 cases per 100,000 population. This is a decrease from last week when we reported 50 cases per 100,000 population. So this is based on the completed week, but if we just look at what happened in the past 7 days, looking at the past 7 days, our rate is 38.1 cases per 100,000 population. And again, this is a decrease from last week, when we were at 48.5 cases per 100,000 population. Comparing our weekly case rates with the province as well as the southwestern Ontario, we can see that the province in the yellow is creeping upwards with the case rates increasing, and the case rates for the southwestern Ontario is also increasing, whereas the Windsor-Essex cases are relatively stable at this time. Looking at our wastewater surveillance data in the past week, our numbers jumped. While it didn't drop to low levels from prior weeks. We may see more cases in the community, but this again is not reflected in our current case counts. As we can see that these red dots is indicating that there may be a possibility of an increasing trend or increasing cases in our community, but that hasn't translated yet into the number of cases. So something that we need to be mindful of, and it could be an early indication that maybe our case rates will increase in the coming weeks. Looking at our person positivity and the number of tests that's being done, in total in our region, more than 300,000 tests were completed as of March 20th. This is a complete week which ended on Saturday. And for the week ending on March 20th, our person positivity was 3.6%. And this has also increased from last week. Last week, approximately 5,456 tests were completed, and among that, we can see that it's a very steep decline from where we were on the weekly weekly testing. So the testing has definitely gone down, and what we are looking at with respect to person positivity, that's increasing slightly in our region. looking at just at the most 7-day data with the person positivity, our data stands at 3.5%, which is at the sixth highest person positivity in the province. Looking at our person positivity by age groups, we are seeing a slight increase in the 18 to 34 age group range, and the person positivity for this group is currently at 5.3%. And again, this has increased from last week when it was at 4%, so something that we need to be mindful of, especially in that age group with the cases increasing in that particular age bracket. So this is just zooming into 2021, what's happened in 2021 with respect to person positivity and by age. And we can see that based on different ages, this is what the person positivity look like. This slides look at the breakdown below the age of 18 with a special focus on school-age children. And we see that overall person positivity continues to decline across 2 of the 3 school age group, except for the 14 to 17 age group, which was trending in the opposite direction. But we have to be careful in interpreting this number, because the number of people who are getting tested in this particular age group is relatively low compared to what we have seen in the past. Looking at the epi curve among school-age children, our current 7-day average is 4.1, which is higher compared to last week, when it was at 3.7 cases. Comparing our school-age 7-day average to our overall 7-day average cases, the difference is trending upwards for school-age children and compared to the overall general population. So something that we are keeping a close eye on. Right now, we only have 1 school in outbreak, but we are seeing cases in the same age group, but not resulting in any outbreak at this time. Our overall cumulative case epi curve for school-age children also show the same pattern, same trend that's we are seeing across all the region, where the flattening has slowed down and starting to increase, especially in this age, slightly. This graph looks at the percentage of test results, all test results that are available within 1 to 2 days of someone getting tested using a 7-day average. And approximately 68% of tests are being processed with the results available within 4 days of being tested, an improvement from last week, where within 2 days of testing, 96% of test results are being processed with the results available. This continues to remain high since late January. When comparing ourselves to the other health regions using the past 7-day average, we are now in the middle of the pack, where 62% of the test results are processed within 1 day. And looking at how long it takes our results to come back for a person tested in Windsor-Essex, currently it is approximately 1.4 days, a slight decrease from last week. Our overall cumulative case rates compared to the rest of the province, we are at the 3rd highest rate. We have the 3rd highest rate in Ontario, which is currently being overtaken by Toronto, and Toronto and Peel leading the case rates in the province at this time. These are the overall rates, focusing just on the rates by each of the municipalities in Windsor-Essex. What we can see overall right from the beginning of the pandemic, Kingsville and Leamington have the highest rate in Windsor-Essex, followed by the city of Windsor. And just in the last month, starting from March, similar picture where Windsor is leading the pack with respect to the highest case count, given the high density population in the city, followed by Tecumseh and Essex. The distribution of cases, again, this is an overall picture. 56% of the cases came from the city of Windsor, followed by 16% of cases from Leamington and Kingsville, while the rest of the municipalities have similar case rates. Just in the last 30 days, similar picture, majority of the cases, 70% of the cases coming from the city of Windsor, while the rest of the municipalities have similar number of cases. Similar trend in the last 7 days. And with respect to age and sex distribution, we have seen an increase in the cases in the 0 to 19 age range. As you can see, a sharp increase in the last 2 weeks compared to the overall case rates, and also in the between the ages of 40 to 49, trend that can be that we have to continue to monitor. And on the other hand, we are seeing a decline in the cases in the 80 plus, 70 plus ranges, partly because of the vaccine rollout that is being very successful, with more than 90% of the people vaccinated in the 80 plus age group. We can see a huge decrease in the overall cases in that particular age group. Looking at the non-epi linked cases or the community transmission in our area, what we have seen is about 28% of our cases don't know how they have acquired the virus. And the last 3-4 numbers obviously are, the numbers from the last 3-4 days are obviously subject to change and are preliminary, and some of them would be currently under investigation. Overall, this is what the picture looks like for the exposure history, with the red, as we can see, is a result of community transmission, and the other colors specify the various source of exposure. Focusing just on between March to present, just this month, we can see many reds here, which is the community transmission, followed by mainly the household contacts that we are seeing in the yellow. And overall, if we're looking at the main sources of acquisition starting from March to present, household contact continues to be the most common reason for the case acquisition, with 27.5%, while the community transmission is around 25%, or a quarter of their cases are coming from the community transmission. This is the picture by each of the municipality. And this particular slides talk about the variant of concerns, the epi curve, and we are seeing now consistently the variant of concern in our community on a regular basis, which is something that we definitely want to remind residents to take precautions when they're out there because of the high transmissibility of many of these variants of concern. Looking at how these variant of concerns are acquired in the community, majority of them are acquired through a household contact, followed by the community transmission, which is a significant concern, because when we're looking at 17.6% of the cases acquired through community, that means there are cases of community, there are variant cases that are out in the community, and people are getting the disease from them. And so when you are out and about in the community, make sure that you are following all the public health precautions, and everyone else, the businesses, the owners, the restaurants, everyone else, they need to ensure that they have all these screening practices and public health measures in place to ensure that they're keeping everyone safe. Looking at the number of outbreaks, we currently have 11 outbreaks, and this is similar to what we had last week. With respect to COVID-19 hospitalization, we are generally seeing a decrease in the hospitalization in Windsor-Essex in the blue line, we have seen a significant drop. But on the flip side, we can see that the number is increasing in the province of Ontario with COVID-19 hospitalization. So generally speaking, with respect to hospitalization and care, we are doing much better. We are seeing less people in the hospital, which is great. Similar situation in the ICU. Ontario is seeing an increase in the ICU admissions, whereas in Windsor-Essex, we are relatively stable with respect to ICU admissions. With day-over-day admission in Windsor-Essex for COVID, we are seeing a declining trend. Overall, we are, we're still seeing some days with more cases admitted, but generally the trend is moving in the right direction with fewer cases in the hospital system. With respect to acute inpatient capacity, the hospitals are operating at more than 90% capacity, and then when you factor it in with the precautions and the isolation that is needed for COVID, this is working on beyond the capacity, 100% capacity. Situation in ICU beds, similar picture. Oops. Sorry about that. Can we move to slide 41? My apologies for that. I accidentally pressed a different button. Okay, so where we are right now, 95% of our cases are resolved, with 1.4% of the people currently self-isolating at this time. Unfortunately, we lost 2.9% of our population who got infected by COVID. With respect to deaths, as we talked about, sometime we report more deaths in one day, and other days we are not. But overall, looking at when people are dying, this is the picture where it just breaks it down by the number of deaths. But so far, we have not experienced a death in over a week, and which is a great news, and we hope that we can keep it that way. Looking at the people who lost their lives as a result of COVID, we have seen more female died with COVID diagnosis compared to male. And from an age distribution perspective, 63% of the deaths were in individuals that are 80 years and older, and the youngest person who died in our region was a man in his 20s. Our overall case fatality rate is slightly higher than the province of Ontario, but our case fatality rate in the long-term care home and retirement home is slightly lower than the provincial average. Looking at our doubling rate, day-over-day comparison, our doubling rate is much better than the Ontario and Canada, as evidenced by the blue line. As we can see, the red and the green line representing the province and Canada is at a lower number. And in this particular graph, if the doubling time is high, that means we are doing better. If the doubling time is low, that means we're not doing good. Looking at our median are not effective is right now, it's currently is at 0.9, and this is the same as last week. And as we have talked about, when the R naught is less than 1, that means the infections are improving, and there are less new infection compared to what we have seen in the past. That means our case counts are decreasing. So in summary, our case rates in Windsor-Essex was lower for most completed weeks, and acquisition source continues to be between the close contacts and the community transmission. Overall, our hospital systems are doing much better with the lower hospitalization and ICU admission. The number of outbreaks is unchanged, but as we reported yesterday, there is no long-term care home, retirement home currently in outbreak, which is a great news for our community. And our doubling time in Windsor-Essex has improved over last week. And last but not the least, in terms of the monitoring indicators, our most recent completed weekly case rate is 44.7 cases. But if we just look at what happened in the last 7 days, it is at 38.1 cases per 100,000 population. And when we are looking at the percent positivity for the full complete week, it's at 3.6%, and that partly results from less number of cases less number of people who got tested for COVID. And our most recent 7 days percent positivity is 3.5%, and our R not effective is right now at 0.9%. So as we can see that if we are just looking at the last 7-day rates, our indicators qualify for us to be in the orange zone, but the percent positivity is definitely higher than where we need to do. And as mentioned yesterday, we didn't have any discussion with the province, and I'm not sure that if there would be any changes we are anticipating today. But overall, our cases are in a much better position compared to the provincial case rates. The province is seeing an increase in the number of cases, while we are seeing a relatively stable and or declining cases in our community. And we hope that we can keep it this way, and we can keep our community safe, and we can keep many of the businesses and everything open as we have right now by following all the public health measures and ensuring the safety and well-being of our entire community. Thank you.
We'll now take questions from the media. Today we'll start with CTV.
Yes, good morning. Do you think the region is still heading in the right direction, or are you concerned with some of these indicators like the percent positivity and the wastewater indicators?
Yeah, the wastewater indicator is an interesting one because we, despite the fact that it is still a research study, and the validity of and the correlation of this is still had not fully established yet, but we have seen a strong correlation if we are seeing the wastewater SARS-CoV-2 viral load is increasing, it has an impact on the community. We have seen that in November and December trend. So there may be some relationship, but just 1 or 2 days spike, it can mean nothing. And a lot of that is also attributed to some of the other external factors. So it's not an accurate mechanism to say that with certainty that this is the case, but it is a concern, and I'll be looking at the numbers carefully in the next weeks to see if it truly has an impact on our case rates in our community or not. With respect to person positivity, I think that's, again, it is a function of how many people were getting tested. If people who have symptoms and if only them they're getting tested, the person positivity will increase. And people with mild symptoms, if they're not getting tested, then obviously the person positivity will continue to increase. I think when we are looking at the other indicators such as hospitalization and others, so it gives a good understanding of where we are, but it is a concern, and we would be monitoring all these indicators carefully to see how it will affect our community.
Thank you. And we're just wondering, why are gyms being left behind in the capacity rule change? Now, I know this is a provincial decision, but what is your message to gym owners and members regarding the rules of only 10 people?
I honestly, I don't have any specific message, and rightly as you identified that it's a provincial decision, and how they come up with that decision, I'm not entirely sure, but this is where they are, and I can't say that what's the rationale that why they were not included in that, because as I was not part of that discussion.
Is there anything that can be done locally, or it has to come from the province?
Unfortunately, I only have the authority to close things down and not to override what the province is closing. I cannot open things up. I can understand their concerns. I can understand their frustration, but this is not something that I can do anything. It has to be something that needs to come from the province.
Okay, thank you.
Any questions from CBC?
Yes, good morning. Doctor, how long would you like to see that case rate within the orange criteria before you'd be confident that the trend is definitely heading in the right direction? And do you think that COVID variants of concern will make the province hesitant or reluctant to move us up to the orange level?
Yeah, generally we always like to see a trend for 2 weeks because that's the incubation period, 14 days that we talk about. And when we're seeing the trend for 14 days, it gives us a little bit more comfort that these numbers are not just a one-time number, and we are seeing a consistent trend. The variant of concern, as we are seeing that we are seeing variant of concern through community transmission in our region, which signifies the importance that things can change. We are seeing an increasing trend in the rest of the province, and our region is lucky not to see similar trend. So things can change, and again, just like I've said this before, we control how and which direction we'll go. If we continue to follow these measures, we can keep all of our communities safe, and we just need to make sure that we are following everything that we are all these protocols, all these guidelines, and everything, and we can keep it that way. But it is a concern that the provincial direction is the provincial case rates are going upwards, and our case rates are relatively stable, and from a province perspective, I think we are least of their concern. They're more concerned about some of the other regions where the numbers are much more getting worse.
Thank you. We got some indication yesterday that the province is looking at vaccinating farm workers on arrival. Dr. Yaffe said she's been speaking with the federal government about it, and if they don't start offering vaccines to workers, the province would probably implement a system for this. I'm wondering if the health unit has been part of any of these conversations, and what's your reaction to the news that vaccines for workers might be coming sooner than phase 2?
Well, any conversation, any discussion with the Temporary Foreign Workers Health Unit, our Windsor-Essex County Health Unit has always been part and parcel of those discussions because we have the most temporary foreign workers, and we have raised these concerns with the provincial government as well as with the federal government too, that these workers need to get the vaccine in a timely manner to protect them because they live in a congregate setting with a high potential of COVID transmission, and especially with variant of concerns bringing in from different region, it is a concern. And we were part of that discussion, and right now under the provincial priority, they are in phase 2, and looking forward to hear further from the province that how they are how they will plan to enroll the vaccine, how they plan to roll out the vaccine for this particular group.
Thank you.
Any questions from Blackburn?
Yes, good morning. Teresa, could you talk about the decision to open up the registration for 70 plus? Have enough of the 75 plus have an opportunity to make appointments, or what went into this decision?
So we're tracking everything in our coverage rate. So we know that right now over 80 is 91.3. We did look at all of the people over 75, and right now, based on the rollout with both the pharmacy and the mass immunization clinics, we're at 33.8% of those 75 to 79 that have received a vaccine. But we also know that we are booking about 1,900 people a day. And so our projections by our epidemiologists was that by April 1st of next week, we would probably have given everyone 75 and older the opportunity to book, and we'll be finished with them. So opening up to 70, we know that in the 70 to 74 age range, there's about 22,000 people. And we believe that we can accommodate all of these people moving forward. We also know that in the 70 to 74, that they're already 24% of that age group have been immunized. So we're just going by the numbers and making the best decisions and opening things up as we see available spots as well across our booking system. So we're able to have a good idea of when we would be moving forward, and based on the weekend coming and knowing that we would be into it next week, we wanted to open it up today. And anyone needing assistance through the call center, there are a lot of resources dedicated to help people get booked. So it's kind of a fine balance. We know the vaccine supply also plays a factor in this, but we're wanting to give people an opportunity to book and plan for vaccinations as quickly as we can notify them. So kind of a lot of things. Also, it required a conversation with the province and looking at our numbers and making sure that we were aligned with their direction as well.
So assuming that a lot of this population has been vaccinated through the pharmacy program, and then some of them were probably recommended through their doctors because of their current health scenario, is that kind of how most of those have already been vaccinated in that age group?
I would say the pharmacy program in our area has done an excellent job of vaccinating quite a few people. As we know, I think it was like around, I don't have the exact number, but like 23,000. The other way people are getting vaccinated is through their designation as a healthcare worker and the different categories. So as we move down from the highest priority healthcare worker to high priority. That encompasses a lot of people, and not necessarily over those age groups, but across our communities. So we're seeing, a good coverage in our community through several different avenues, but you're correct regarding the medical condition one as well, that people are eligible.
Okay, thank you.
Any questions from AM 800?
Teresa, just following up on Maureen's questions, is there enough vaccine right now? I know you were mentioning we're going to get a drop in early April. Is there enough vaccine right now to do the 70 and over? And if we have more than enough, could you see it expanding to 65, for example, and older?
So the answer to the question about the vaccine, we do know there's a slight delay again with the Moderna vaccine. And we also have healthcare providers that are assisting with the vaccine rollout. So we're managing all of the supply. We work very closely regarding the supply allocated to our area. So between Pfizer and Moderna, we are looking at all of it. So I would say that we're not in a great position because nothing has really changed. The numbers that we shared before are basically the same, and we're using all of it. We'll know more. The ministry usually gives us a couple weeks lead-in time regarding the vaccine. So we know that we hope by, I'd say even next week, to hear more firm numbers regarding Pfizer. But the numbers are the same for the next 2 weeks into April. Those 2 weeks, there's a little bit less of the vaccine. But if we are able to continue vaccinating this group and get a higher coverage rate, and as you know, we're tracking it every day, and we're able to have our epi look at that and make sure the numbers are what they are. But we would want to see a good percentage of the 70 to 74 and the 75 to 80 and all of those, even the 80 group. Like, I know 91% is great, but that's still 9%. So there's still probably less than 2,000 people that are out there that could get the vaccine. So we're doing a really good job, but I'd say, yeah, we need more vaccine.
And you mentioned in the answer to Maureen how you have to get the province on board with this. So does that mean we're one of the first ones in the province to be vaccinating 70 and older?
I think there are other areas, health unit regions, that are doing the same, but the province, because we're not on their provincial booking system, they would want to hear to make sure that we are, filling up our spaces and that there's good coverage and that we're adhering to the established, age groups. So I think you'll hear a lot more about people moving to 70 based on whatever population, as we know that we had in our 75 to 79, we had 15,000 people. And like I said, we were in, even if everyone, anticipating all 100% are getting the vaccine, we were going to run out, we would finish them by next week. And so opening it up is good for us, but I think you'll see others follow as well based on the progress they're making.
Thank you. I have one question for Dr. Ahmed, just in regards to the zones, the color zones. Obviously, we're in red now, and I know it comes down from the province. They ask for your recommendation or your advice. But I was just looking at other areas that are in the orange zone. For example, Middlesex, London. Yesterday, they had 43 new cases. They have more variant cases than us, and they're in orange. And I know there's different criteria, more than the variant and just the regular case counts per day. But I guess for the average public or the average citizen looking at different areas, do you think people are going to start questioning some of this stuff?
Well, again, so sometimes these numbers are hard numbers, as you mentioned, that there are other qualitative data that goes into the discussion too, and factoring it in what's happening with the rest of the province. It's, I think I don't know what parameters that they're using for other regions, and I don't know all the details about any other region except for my region. And as we talked about, there are some areas of concerns in our region, but generally, I think we're doing much better. And I say that with a grain of salt in my mouth, is to make sure that we continue to do better. Right now, our case rates are low. We need to make sure that we continue to do the good job that we are doing right now in keeping the case counts down. We definitely don't want the case to increase. And with the cases increasing in the province, I can, I may be speculating, but I can understand from the provincial perspective, they don't want us to move to a lesser restriction, only to move back to the red zone or the gray zone. There has been some conversation at the provincial level that maybe is there a third lockdown that needs to come from the province? We don't know any of that. So I think where we are sitting is a much better position, and we need to make sure that we can keep it that way if we continue to follow all these measures. And with everything else that's happening, I think it's even more important for us to continue to do what we're doing right now to keep our community safe. And with many more businesses opened up with the loosening of some of the restriction last week, I think, again, this is a good sign for and support for the business community in getting some of these restrictions eased. But I know that there are some other businesses that are still impacted by it. So there is no one solution that can fix everything. I think we just have to be careful, and we have to see what kind of impact it will have in our community with everything that's going on in the province.
Thank you.
Any additional questions from CTV?
Yes, just one more question. Do you think there is much of a difference between orange and red as far as the transmission risk and the risk level for the community?
Good question. I think generally speaking, not a lot. I think the most significant piece, as we know, was with the restaurants and the businesses that are able to meet that capacity limit now. And this capacity limit is, I think it's a big change, and we don't even know what kind of an impact it will have in the community. So far, I think things are moving well. And we want to make sure that it continues to move well in that direction. I don't have like a full comparison right now in front of me to tell you what exactly changes from red to orange, but not a lot, except for the businesses which has already had seen some of the restrictions eased.
Okay, thank you.
Any additional questions from CBC? Any additional questions from Blackburn?
No, thank you.
Any additional questions from AMA 100?
No, thank you. Have a great weekend.
Yes, have a good weekend, everyone.